I'm going to ask that we come to order. We are now rounding third base, so let's bring it on home. We have our last and final hearing with the Health Department. We do have before us Dr. Paul, who is the Director of the Health Department. He has with him Mr. Stan Romine, the Director of Finance and Administration, and Ms. Diane Harding, the Director of Financial Management. So I will turn the floor over to Dr. Paul.
Thank you, Mr. Chairman. I want to thank the members of the committee and the chair for allowing me to reschedule so that I could attend my son's graduation from high school. So I appreciate that, appreciate your patience. Also, as a dad, I want to thank you for your support for public education. At the Health Department, we understand and we support the mayor's priorities, and we realize that you have a lot to consider this year. We will do the best we can with the budget that you appropriate for us. We are working with a shrinking local commitment, shrinking local investment in public health. In fiscal 2008, we had 291 staff members on local funds. This current fiscal year, local funds are supporting 208 staff members. The budget before you cuts 2 additional positions to 206. That's a 29% drop in positions in 5 years. The proposed budget is a 21% decrease in local dollars since 2008. The work of public health is all about creating conditions where people can live healthy lives. If our people are healthy, Nashville can thrive. Healthy children learn better. Healthy workforce helps attract employers and jobs. And that's what we're here to do. That's what we're here to support and provide. Here are a few highlights from the last year. Communities putting prevention to work, large project, federally funded, over 20 projects helping make healthy choices easier for people throughout Nashville. Mayor Dean's leadership and our community's progress was highlighted in a recent HBO special called The Way to the Nation. We also kicked off the New Life Project, also federally funded, comprehensive effort to help high-risk children by helping men develop their skills to be better dads. We also opened a new WIC Nutrition Center on Nolensville Pike to better serve our growing numbers of customers. Our children's oral health program continues to drive down the amount of untreated oral disease in Nashville school children. Food protection system continues to make sure every food service establishment is doing what it needs to prevent foodborne illness. We received recognition this year for our improvement in immunization rates. We implemented a domestic hen permit process in response to your ordinance. We implemented a 1989 Metro ordinance regarding radon that required testing 339 buildings and conducting over 9,000 tests. Just last month, we provided emergency nursing and animal care support for the residents of Parthenon Towers as they were evacuated and sheltered over at Lipscomb. The list goes on. But I want to talk just a little bit about the proposed changes in the budget before you. We are proposing to move some local positions to a family planning grant. As you know, we received an increase in family planning funds from the state at their request. These were funds that had been previously allocated to Planned Parenthood. Our expectation is that these funds will expand service and also basically to see clients that were not able to continue at Planned Parenthood. Now we've watched this, and over the first several months of this change, Planned Parenthood has seen a gradual decrease in their clients, and we've had gradual increases. And so we believe that at this time, it looks like we can reduce Metro's subsidy of the family planning program and still provide some service expansion. That's the biggest reduction that you have before you. The mayor's proposal includes some added positions, improvements. First is a restoration of 2 FTEs in prevention and wellness. Now in fiscal 2011, we put 4.5 positions on communities putting prevention to work, which is our stimulus grant. This enabled us to avoid layoffs as we took significant local cuts. That stimulus grant is ending. The proposed budget restores a portion of this core capacity. There is a position there to implement the radon program. And then for animal control, I just wanted to spend a minute here. In 2007, Metro Council actually increased the total staffing from 29 to 31 animal control officers. With the last several years of economic crisis, we have lost local funding for 3 animal control positions. We were able to support 2 of these with our stimulus grant, but that is ending, and that leaves 2 positions no longer funded with CPPW. Now, last year you were able to put an additional position in, and I've talked this over with Mr. Riebling, and he's aware. I'm going to ask you if you would potentially consider the restoration of 1 additional position. This would bring us up to 29 officers, our baseline number in 2007. As always, we will do our best with the budget that's appropriated. We will be more comfortable meeting service requests, and some of them related to chickens, if you're able to support restoration of an animal control officer position. Finally, as a health director, I would note that the mayor's priorities do support the fundamentals of health. The more success our city has in making the schools work and making our every neighborhood safe and secure, and in creating a livable community, those goals, if we reach them, everyone will be healthier. And so I have to say that I can't argue against that. So once again, thank you for your commitment to Nashville's health, and willing to take questions.
Thank you, Dr. Paul. Councilman Tiger, you have the floor.
Thank you. How many chicken permits have been issued approximately so far?
125.
Okay, so if I'm hearing you correctly, the animal control officers would be the position if there were a complaint from a neighbor or an issue, and you're at a lower level now than you were 4 or 5 years ago, yet I doubt we're, as a community, have less dogs, less cats, less skunks, less...
We'd like to say we're making progress, but I think it's not really that much less, and that we feel like the chickens haven't added that much, but we are below where we were, and we're not comfortable with it.
And hopefully they won't. And I think from what I've seen of the chicken community, at least at this stage, they're the responsible people who want to do it right. They understand that we're under a sunset provision, and if we don't do it right, we run the risk of that program going away. So I have a sense that it's not going to be a huge problem, but it's still an increased workload on your all's behalf.
That's correct.
Okay. Tell us how the 2 positions in prevention and wellness will be used, and how will we measure their success?
These are core positions in our efforts to coordinate community activities. A big focus for the last couple of years have to do with healthy eating and active living. And so measuring success is largely through projects of the kind that you've seen with communities putting prevention to work. There are some of those that we really do need staff to continue. We do have some interest in sustaining gardens as an example, working with various agencies, whether they're employers, whether it's youth serving organizations, to help them move towards healthy living, healthy eating and active living for the clients that they serve. So it's in the long run an investment in reducing Nashville's obesity. The specific positions, one is basically program director that was moved off onto the grant, and we would like to be able to bring that person back into Metro.
So if a community that was into gardening was partnering in a school on food to cafeteria type issues, organic food to cafeteria, if there were specific programs that were targeting childhood obesity and healthy lifestyles, would your 2 positions be in who we should contact to help coordinate and assist, running the risk of you getting 500 phone calls tomorrow if your answer is affirmative?
That would be our core capacity. I mean, part of what the work of our unit is to try and leverage others and work with others, and we do have lots of collaborations with the schools, collaborations with, say, for example, Alignment Nashville, with the mayor's office, to implement these projects. So it's bare bones. This request is very bare bones, and it doesn't really afford a large amount of technical assistance to requests from the community.
Long term, is your department where should your department be the point department for these type of issues that you've described, the programs in schools and alignment national? Part of the problem I see now is we've got so many well-intentioned folks, but everybody's out there inventing the wheel as to what to do and how to do it, and they don't know that the east side of town's done this and the west side of town's done that, and the north side of town doesn't know what the east or west is doing.
Really a key element of this is keeping communications going, and that's part of what we've tried to establish is basically a newsletter and a clearinghouse for information. There's a lot going on in Nashville that we don't do as the health department, but we want to make sure that people who need a resource have a way to locate that. And so it's important for us to stay connected to everything that's going on in town. And I believe we do have a leadership role, both in supporting the mayor as he's been out in front on this issue, but also for the long-term health of Nashville.
Well, I'm thrilled that you have seen the two positions there as a priority, and I'm hoping that in the future we would expand so that all of these type of issues can be centralized in the health department, because ultimately that's the best place to measure success and to disseminate information as to successes and failures and best practices and these type of things.
Well, we will be doing the best we can to sort of re-piece together the 4.5 positions that were moved off. Where 2 is a start.
Thank you, Councilman Tiger. Council Lady Bennett.
Thank you, Chair. Dr. Paul, appreciate you always. You're very great to talk to. You're always thinking about it on a different angle. You see things in a very enlightening way. I want to understand, so animal control, we added 2 positions how many years ago?
That was 07.
Okay. And over the course of the cuts, we've lost 1 and now the second one, is that correct?
We've actually lost 3, and what I'm asking you for today is to get to the baseline before the 2 that the council added. So from
you're just
29,
asking for
you all,
one.
or your predecessors in 07 raised us from 29 to 31. Now, the budget before you brings us to 28, and I want to at least get us to 29.
Okay, so you
we
feel like
we were able with the CPBW, the stimulus grant, to cover some of those through the worst of the budget cuts.
Okay. All right. I would like to put that on my wish list, please. And
cool.
if you could provide the amount. Have you got it? Okay.
44,546.
I appreciate that. Please add that to my
19
wish
cents.
list.
Thank you, Council Lady.
Thank you.
Duly noted. Council Lady Johnson.
Thank you, Chair Matthews. Dr. Paul, as always, yes, you do a tremendous job in your department, and I appreciate everything you do within our cities and within our city and our communities. The question I have is in the reduction in the area of communications. I just saw a large decrease on H15 of 20.51%, and so I just wanted to make sure that a reduction in that area is not going to hinder what Councilman Tigert has just expressed.
Those are grant funds, so they wouldn't be affected by the local budget.
Okay.
We do, I mean, I didn't spend a lot of time on it, but we do have the ending of a very large federal grant. We have another large federal grant that's starting up, but then state grants are always under pressure, and so we are seeing cuts in other areas as well.
Okay, thank you.
Thank you, Council Lady Johnson. We don't have any other council members in the queue, so Dr. Paul, I would like to thank you for coming out, and this concludes our budget hearing.